Welcome to this year's MTSS Summit titled Where MTSS Meets Mental Health. This year, we're focusing on how to integrate a continuum of mental health prevention and intervention services into schools. Turns out, schools are the primary setting where young people access needed mental health supports, and improved mental health and well being are critical enablers to students' academic success and eventual life success. My name is Clay Cook, and I'm the Chief Development Officer at Character Strong. And I'm here today with Dr. Sharon Hoover, who is a licensed clinical psychologist, a professor at the University of Maryland School of Medicine, and the co-director of the National Center for School Mental Health. She leads national efforts on across states, districts, and local schools in the adoption of national performance standards for comprehensive school mental health systems. And in my view, and I'm telling you the truth, Sharon, there is nobody more influential in the entire field than you. The work you've done that has spanned multiple years has really improved the school-based mental health efforts and enabled many, many, many young people to access needed mental health care. So thank you for your work and welcome to the summit today.
Thank you, Clay, and thank you for your generous words. I am very fortunate to have a fantastic team at our National Center for School Mental Health and to have lots of great partners. So thank you.
Yeah, you've done tremendous work. The center has done tremendous work, and the field owes you a debt of gratitude for that work. I want to start with your story, though, in just a couple of minutes here. Share a bit about your journey and what has inspired you to become interested in school-based mental health over time.
Sure. So, early on, I thought I would be a teacher. So I probably always had a bit of a bent towards education. And in many respects, I still am a teacher as a professor at an institution of higher education. But I also learned pretty quickly in my undergraduate training that I wanted to go into mental health and psychology specifically. So I studied clinical psychology and did lots of different rotations and really had the fortune of being in a variety of settings during my training experience. So inpatient settings, outpatient, community mental health centers, and schools, working with adults and children. So really had this nice view into the different settings where we see people and support their mental health. And it was in my final year of training, actually, right as I was figuring out what I was going to do for the rest of my career, that I was spending my time really in three different rotations. So I was spending about half my time in schools, and that was in Baltimore City, where they actually started one of the first school mental health programs, community partnered programs in the nation. And then about half my time in an outpatient mental health center. And then I guess not much time is left, but I actually spent overnights in the emergency department, admitting kids or assessing kids for potential admission who are experiencing psychiatric issues. So during that year, it really crystallized for me that we were doing a disservice if we were not supporting our young people upstream and where they are. I loved my work in all of the settings in many respects. And I see that there's a need, right? There's a need for having pediatric emergency department services for kids with mental health challenges, but I don't think most of our services should be there. And community mental health services, as you probably know, often have a no-show rate of over 50%. That's kind of the average. And most young people only make it to anywhere between 1 and 4 sessions. So our traditional mental health systems weren't working. And I just had this opportunity to experience that firsthand. And being in schools, you really get to work with not only the students, but all these kind of social determinants for them, right? So the systems, but also the people that influence them, the adults, the educators, the families, and their peers. So for me, it was kind of a no-brainer to go into this space. And I was just super fortunate to be in Baltimore, where the National Center for School Mental Health was housed at the time.
Two words that are really a statement. You said upstream and
Yep.
where students or where young people are. And
Yep.
all of a sudden you start to look like in society, where is that? And then schools open up because that's where they are. And it does provide kind of the upstream prevention, which is a nice segue to MTSS. Because one way to think about it, it's a framework for how we start to organize our behavior to enable prevention and early intervention to happen. And at Character Strong, we talk a lot about low burden, high impact practices. And I know you think a lot about through the multi-tiered lens and the idea of tier one prevention. One of the things I was going to ask you, and it's kind of an unfair question, but if you're going to pick like one practice,
Yeah.
and for the purposes of prevention, and if every educator invested in implementing that one practice for every student, what would it be? And it's really targeting their mental health and well-being, but as enablers to academic, what would the one practice be?
So I will say I do love the focus on high impact, low effort or low resource intensive practices, because we often see vendors coming in with these, bells and whistles interventions that are so hard to implement at times. And there's so much we can do that's actually not as effortful, but can have great impact. So I love that focus, first of all. I'm buying some time to think of what would that one intervention be. Okay, I'm gonna take the liberty of offering one at each kind of sphere of influence of an educator. So one would be those like direct interactions one-on-one with students. So for every teacher, I would say if they could be intentional about creating two minute connections with
Mm.
students, and it could be one student a day where you go into the school day and you intentionally make a connection. It could be through naming the child by name, asking about their interests, checking in about their day. So just that 2 minutes with each student once a day, right? Or one a day, I should say, one student a day, and particularly focusing on students who may be struggling, who may be withdrawn, who may be isolating, who may be having behavioral dysregulation in the class. So it's those quick check-ins, but really being intentional about it and using 2 minutes of your day to do it. Okay, so that's one. That's the one-on-one student. If I think about, well, what could a teacher do? What should every teacher be doing in their classroom? It would likely be a moment of gratitude or a moment of mindfulness. I know that's two things, but it's really just, again, that intentionality around creating space and time in the classroom where you're focused on well-being. And we know that practicing gratitude or practicing mindfulness or taking a brain break can really promote well-being. And it doesn't have to be an hour-long effort, right? It could literally be a minute or two. Post the sticky note, gratitude statements on your wall in the classroom every day, or shake it up a little bit. But it's creating that intentionality with your whole class. And then the final thing is kind of what could you actually embed more into the curriculum, which does take a little bit more effort, but it's somehow finding space for mental health literacy, where you're providing some education throughout the course of whatever it is you're teaching, where you integrate mental health in, and you're teaching kids not just about how to identify mental health concerns, but also how to promote mental health, positive mental health, right? And it could be things through nutrition or exercise or sleep or gratitude or mindfulness, et cetera. So that was more than one, but there's a lot of things that we can do at that tier one level that, I think sometimes go a bit unappreciated because they're not always part of a packaged program.
Yeah, and I love your suggestions here on how they can be infused within, because when we're saying integrating mental health services, what we're not saying is like stop doing academics.
No.
What we're saying is find the opportunities where we can insert and infuse it in as part of our efforts to promote students' academic development. And those little nuggets provide those windows of where we can insert and integrate it with academics, and it doesn't have to be kind of a zero-sum game where if we do focus on mental health, then we're giving up a focus on academics. No, we can maintain that focus by finding those opportunities for insertion. I love those suggestions. So next question here. Through MTSS, we know it's a pretty ambitious framework, because at the end of the day, it's what it says is we're going to work towards making sure every kid can access the level and type of support they need for success in school.
Mhm.
So when we think about MTSS and mental health kind of fitting in, what comes to mind? How do you see it fitting in with an MTSS framework that a school should be championing around promoting students' academic and behavior success?
Yeah. So to me, MTSS is the ideal framework for integrating mental health into schools, in large part because it mirrors what we do for academic supports, right? So we do provide some general supports for all students. We do have processes in place, hopefully data-informed processes that identify when students need a bit more help. so that we know who to provide some more intensive interventions to. And then when we can kind of ratchet those interventions down if they're not needed anymore. So that framework is already in place for academic supports. And we also know that in order for students to succeed academically, they have to be healthy, right? Both physically and mentally. I feel like it goes without saying, but it's true. Students need to be well in order to learn. So we have to put a tiered system of supports in place for that, academic thriving to occur. So in simple terms, we've got the 3 tiers, right? And at tier 1, that's going to include things like we talked about, mental health literacy, those mindfulness moments, social, emotional, or life skills that we teach, that we have to teach for students to be college and career ready, in secondary school. So SEL or life skills doesn't go away after kindergarten, right? We still need those life skills, whether it's empathy building or resilience skills or problem solving skills, all these things that make our students ready to go out into the workforce or to interact with their peers and their families. That has to be embedded universally. So those are some tier 1 supports that need to be in every classroom and in every school, certainly also things like positive school climate efforts and promoting positive behaviors. The second tier, right? So this is for our students who may be experiencing kind of mild to moderate mental health concerns. And this is what we often call the missing tier, because in mental health in schools, I find that sometimes we have pretty solid tier 1 supports, and then we default to tier 3 supports whenever a student is experiencing mental health challenges, because that's kind of the system that we might have in place, either through special education services or through a community mental health partnership. And for example, if you have a community mental health partner who comes in and does fee-for-service intervention, they might have to diagnose in order to bill for their services. And so you end up defaulting to a high level of care if you refer students for mental health care. My wish would be that we could, and some schools do a beautiful job of tier 2, I should say that. My wish would be that all schools would put these interventions in place. And these can include things like check in, check out, brief interventions that have motivational enhancement or some kind of getting kids back on track academically, to really address those mild concerns that don't require intensive treatment, right? Not every young person needs intensive mental health treatment. School may not be the place to do that mental health treatment. We know that some treatment can occur in school, but again, not every student needs that. So then there's tier 3. I do think mental health treatment can and should occur on the school site, but I just want to make sure we reserve it for actually high intensity needs, right? And so that could include individual therapy, could include family therapy on site. When I was a psychologist in the schools, I did a lot of work with families right there in the school building, and it was accessible for families. So the multi-tiered system, it makes perfect sense for integrating mental health. And I think we see lots of really good examples of how this is being done on the ground.
Yeah, I love the emphasis on the missing tier. We do see that a lot. It's like tier 1, there's some things happening. Tier 3 typically can be more intensive, and it often is a missing piece to really enable early intervention for students with mild to moderate needs, and they don't need more intensive support. How do you, you've done implementation efforts not only in the US, in other countries as well. So your experience when the kind of rubber hits the road, what are some of the common challenges that people encounter? What do you see as some of the when we try to use MTSS as a framework to integrate mental health services? Where are the challenges, and what do you see as needed to overcome those challenges?
Yeah. I mean, none of this will surprise you or, the listeners probably. We hear a lot about funding and we hear a lot about staffing. And I do think those are legitimate issues that we run up against, right? So funding, for example, we know funding is often time limited. So sometimes school mental health efforts are funded via grants to districts, for example. We have a lot of wonderful federal funding that came down the pike over the last few years that really helped to build up our school mental health pipeline. And some of that was COVID relief funds, some, were other federal funds. But there's a worry that when that dries up, the staffing will go away, the funding will go away for some of those supports. So there's legitimate concerns there about not having sustainable funding. Medicaid is has fantastic potential for funding school mental health, and many states have leveraged that. But again, there's barriers there with the administrative claiming, with rural and smaller school districts not being able to best leverage Medicaid. So we're making strides in those areas. But again, things are a bit tenuous in some ways as well. So funding is one, staffing is another. We often talk about effective, comprehensive school mental health systems being partnerships between schools and communities. So when we think about, well, who is that, right? So for schools, it's often your school psychologists, your school social workers, your school counselors, school nurses, other health professionals, occupational therapists, and educators. For
Mhm.
our community partners, it's often your community mental health clinicians, and those, span an array of disciplines as well. But what we often see is that some of those kind of reimbursement challenges get in the way. They may not be able to staff the types of services that are needed. We already talked about tier two. Oftentimes, our providers are not able to fit into their scope or bill for, get reimbursed for some of those needed services. So one of the things that we've seen districts and kind of, institutions and states try to do is create a broader provider array. So leveraging folks like health educators and community health workers to really fill in some of those gaps, peer support specialists. But it does take actually not only creating that workforce pipeline, but also getting reimbursement models in place that can fund them. So it's, a lot of folks will say, well, we need peer support. That's fantastic, but you need to build the training to do it and get the funding in place to do it. And I think, there is good data suggesting that when you do that, they can actually be very effective as part of that provider continuum. So those are some of the big things. I mean, we've already brought up the idea that, academics are the priority, right? They are the bottom line for school administrators. And so there is that ongoing tension of, if we bring anything into schools, is it going to compete with that bottom line, with the priority of schools, which is academics? So I think part of our issue as a mental health system is making sure that we are adequately making the case through data, through compelling stories, um, that by doing mental health in schools, we are raising that, bottom line of academics. There is data on it, but we need to do probably better marketing of it and better studies looking at return on investment and impact on not just psychosocial outcomes, but also those academic outcomes.
Yeah, and there's even data, it's almost like a light switch that someone could have academics, but in terms of mental health competencies, it like enables someone to go move and shake in life to apply their academic knowledge and skills. So even if someone is struggling with mental health and is still able to perform academically, can they go apply it
Mm.
by being engaged and present in whatever place later on in life that requires you to be a collaborating team member, to be a self-sufficient, productive worker within whatever space. It's like those competencies are enablers. They not only potentially enable deeper academic growth, but they enable someone to move and shake and apply their academic knowledge and skills by being present and engaged. And that data is pretty compelling because there's two ways in which the work on the mental health side are facilitative of academics. And you're like, we got to make the case. We're using good data why mental health in schools is needed. Uh, let's talk tier two and tier three. You mentioned a little bit of what that could look like, but what do you think's needed ultimately? Because I look at what we're trying to solve here is the access gap. We have young people with needs. Are they going to ultimately, we got to, in the place where they show up, we want them to access fundamentally what they need. What does it take to actually bring tier two and tier three to life in a school?
Yeah. Yeah, I mean, I would say where we've seen it work well, you have staffing, first of all, who is geared towards using their data to know who needs what, right? So you do need a solid data infrastructure and referral system, whether it's called a referral system, a triaging system, data-informed decision-making about interventions, whatever you call it. You need a system in place where it's not a haphazard way of getting people into supports, right? That you're actually making good decisions about who needs what and when they don't need it anymore, when they might need something different. And what we often see is that schools are creating homegrown systems, right? Districts are creating homegrown data systems. And there's nothing wrong with that inherently, but It's really a inefficient use of resources because there are some data infrastructure, that exist that we could probably do a better job of leveraging across districts and states and even kind of nationally. So I would wish to see that in the future. So first is that data infrastructure and referral systems. I would say, again, at tier two, we need adequate staffing. We need staff who recognize their role to be tier two services and to be trained in them, right? It's not just, lunch bunches and buddy groups. Those are good things to happen in schools. And there are some evidence-based strategies for single session interventions, for brief interventions in schools, for group interventions to target specific areas, and for interventions that are really focused on academics, like student checkup, right? So there's some excellent interventions that weave in those academic outcomes. And I have not witnessed enough tier two staffing in schools where they know that this is their role and they're trained in these interventions. So that to me would be a game changer. Tier three, again, I think we need we need it valued by our school administrators that yes, having people actually treated in the school building is an efficient use of the school day, but it needs to be done really in a way that respects the priority of the school being academics. And that's a negotiation, I think, between community partners and families and schools. And we've seen a lot of school districts create advisory periods, create time in the school day where they can get those mental health or other health supports in. So just has to be intentionally created in the school day. And of course, our reimbursement models have to follow. We have to be able to pay for the services that are happening.
Yeah, it's like it all comes together. People, time, and
Yep.
resources in order to pull really anything off. And from the time standpoint, we look at a lot of master schedules and they just don't, there's not a place for it to live. So people constantly struggle how do we fit this in because there is not protected time. So a lot of times it's really looking at the master schedule. Where could we do this that doesn't diminish the students' participation in academics? And then obviously the people, the staffing, who's going to do this? Are they clear on their role? Do they have access to the training and supports? And then yeah, there's a funding reality that, creates the opportunity for a lot of this to exist. And at the end of the day, if something's a priority, we got to give it time and resources in order to bring it to life. And MTSS is no different. I love the response there. I'm going to bring us over the finish line. We
Okay.
like to say at Character Strong, we probably say it internally too much, but we always say you need to be reminded often more than you need to be taught. What is a reminder you would love to leave people with as they wrap up watching this? That's really important when we think about MTSS and using the framework to really start to integrate thoughtfully and intentionally mental health supports.
I think we need to be reminded that mental health is much more than the 45-minute treatment session that we often think of when we think about mental health for young people or for anyone for that matter. And that there are so many strategies that can and need to be integrated into the school day, again, in that low burden, high impact, kind of realm of practices. There's a lot that can be done outside of that traditional mental health treatment realm. There is a place for that 45-minute treatment session, but there is probably so much more not probably, there is so much more that can be done across that tiered system of supports that would arguably have a greater impact on young people's success academically and just in life.
Love that. There's three words that I wanna that come to mind for me about you. One, passionate, very strategic in how you've approached the work over the course of your career and impacting schools, and definitely perseverant
Mm.
because the work that's happened in the area of school mental health, you have to persevere in the sense of leading to systems change and creating the types of realities for more people to access fundamentally what they need in the place where they naturally show up and exist, and schools being one of those. So big shout out and thank you to you. Where can people learn more about your work and the work of the center?
Sure. Well, thanks again for the kind words, and thank you to Character Strong for all you're doing to make schools better and kids healthier. And you can find out about our National Center for School Mental Health at schoolmentalhealth.org. So it's pretty easy to find us, schoolmentalhealth.org.
Well, thank you for being with me today and have a great rest of your day.
My pleasure. You too.